The interesting thing about what's happening in radiology in the last 10 or 15 years has been the tremendous increase in the number of imaging procedures, especially computed tomography. We've seen about a threefold increase in the number of CT exams over the last decade. And some people are concerned about that because they feel as though that we may be using CT exams inappropriately and too much. But in actual fact, the reason for that increase has been that the technology of CT has become so much more advanced with spiral CT scanning that it's applicable to many more disease processes in many more patients. And so we can do for patients today with CT things that we could never have done 10 or 15 years ago. And that's what's driven the increase in CT examinations from about 20 million per year in the United States a decade ago to about 75 or 80 million CT exams per year today. And that is good news because that means more patients are benefiting from CT procedures than ever before. Over the last 10 years, we've seen a tremendous increase in the number of CT procedures that have been occurring in the US and around the world, for all that matters. In fact, 10 years ago, we were doing about 20 million CT examinations in the US per year. Today, we're doing somewhere between 70 and 80 million CT exams. And some people have said, well, isn't this a concern because more people are getting exposed to radiation? My answer to that, this is good news. Good news because more patients are benefiting from CT procedures, better diagnosis, earlier diagnosis, better treatments as a result, less morbidity because we can do with CT today what we used to have to do with exploratory surgery, and less cost as well. So it's good news. The first introduction by EMI of its first CT scanners, even before they were commercially available, was done here at the RSNA. That was the first public viewing of CT from the company that developed it. As you probably know, there were 2 Nobel Prize awarded in physiology or medicine for the development of CT. And ever since that date, RSNA has been the showpiece for advances in the technology of CT. And it is today. And if you look at the program today of the meeting that is occurring here this week, you will see that CT procedures, CT radiation doses, CT image quality constitutes a large fraction of the entire program. So the RSNA has really been the platform for the evolution of CT and for all the technological developments that CT has experienced. And that will continue to go on into the future. Today, the real challenge is how can we do CT examinations at the least dose possible to the patient while still preserving the quality of the images that will lead to accurate diagnoses. Physicists and radiologists are working together to develop new technologies and new procedures so that we use radiation in the most efficient manner possible while still providing accurate diagnoses early on in the evolution of disease of patients. If there were no RSNA, I think radiology would have by far less of a scientific presence in the practice and in the field of medicine, because it is really the RSNA that is the scientific and educational organization for radiology. And so it is the organization that is looked to by all the other professional organizations in medicine for announcing and explaining the advancements in all the imaging modalities, not just CT, but ultrasound and radiography and fluoroscopy and magnetic resonance imaging. It is the largest medical meeting in the world, and it is the most technologically sophisticated medical meeting in the world. It is really leading the pace for medicine in terms of the evolution of technology and the evolution of informatics and information systems for the practice of medicine. I have been a member of RSNA since 1976. I've been coming to the RSNA meeting since 1965. I have never missed a meeting. I can't afford to miss a meeting because it is here where the technology, all the advances in technology are exhibited. and companies wait to announce their most recent developments for the RSNA meeting because it is the platform. It's had a tremendous impact on me in many ways. I have worked in all the various areas of imaging, radiography, CT, magnetic resonance, ultrasound, and nuclear medicine. This is the meeting that I depend upon to keep me up to date in the advances in all of those fields. And it's not just for radiologists, it's also for radiation oncologists using radiation to treat cancer. And it's certainly a big meeting for physicists who are here to work with the vendors and talk to the vendors about recent developments and also about developments that are needed that the vendors need to help us develop. What distinguishes radiologists from other physicians in terms of the use of imaging is the knowledge of radiologists about the technology and the underlying science of imaging, which other physicians who also have designs on imaging and wish to use imaging, they don't have that background. So if I were a resident going into radiology today, I would do everything I could to really understand the science and the technology of the discipline that I'm practicing, because that knowledge will allow me to use radiation and use imaging procedures in the most efficient manner, obtain the most highest quality images at the lowest radiation dose if I'm using ionizing radiation, and therefore set me apart from other physicians outside of radiology who also are interested in using imaging. My first RSNA meeting was in 1965. It was what we had in imaging at that time was primarily radiography, the use of X-rays for producing flat films, fluoroscopy. A little bit of nuclear medicine was starting to happen in 1965. It was pretty primitive. Ultrasound was just developing, if you can imagine. If you look at RSNA today with the plethora of sophisticated equipment, it's an entirely different world. And what's interesting is that I've watched the transition from the perception of radiology as an imaging science to the recognition today that it's an information science. And we are in the business of creating information about patients individually and collectively that is of use in their care, making sure that they get the right treatment for the right disease at the right time. That's what imaging does today. It's really an information science. It's not just simply an imaging science. In 100 years, it's pretty hard to predict where anything will be in 100 years from now. But as you watch the changes that are occurring today, we are becoming more and more, as I've already mentioned, an information science. 100 years from now or 20 years from now, I think imaging is going to be simply an integral part of the care of absolutely every patient and every individual in this country. Patients, because of the quality of imaging to provide information important to disease and disease treatment, but also imaging as a way, as a method into preventive medicine. And I think that's going to encompass genomics, using information about genes of patients to create the best possible treatment for them, and that will be, imaging will contribute substantially to that. I think we'll see a lot more quantitative data in imaging, so quantitative imaging, genomics, imaging, those interfaces are going to become more and more important in the next 10 to 20 years.